In 2014, the Millennium Development Goal Initiative was started by the government of the Republic of Zambia, the European Union, and the United Nations. The aim was to improve nutritional status for children, increase access to quality reproductive maternal, newborn and child health services, strengthen community knowledge, behavior and practices on health and nutrition, promote adolescent sexual reproductive health, including HIV care and treatment, and strengthen the health system through institutional capacity building and health management information system. It was decided that the MDGI program would support Chilanga Health Center in an immediate facelift and new equipment, turning it into a modern clinic. It went through a transition of changing from what it looked like in 2014. To this in 2016. Maternal, neonatal and child mortality will now be reduced, as Chilanga is one of the 5 districts in Lusaka province where the Millennium Development Goal Initiative MDGI program is being implemented. The MDGI's main objective is accelerating the reduction of maternal, neonatal and child mortality. We visited Chilanga Health Center on the 60th of May 2016 and witnessed the handover ceremony for the refurbished and newly equipped health center. The Ministry of Health, in collaboration with the community and other stakeholders, has scored a number of successes in strengthening the healthcare delivery system. This is in line with the government's policy of bringing services as close to the people as possible. The Provincial Medical Officer for Lusaka Province, Dr. Kennedy Malama, attested this to the achievements scored following the MDGI support.
We are not taking this support for granted, and we continue doing everything possible to ensure that we indeed accelerate progress towards maternal, neonatal and child morbidity and mortality reduction.
The district has embarked on deliberate efforts aimed at strengthening the capacity of health workers, ensuring adequate medical supplies and the involvement of the community at every stage of the health service delivery system. Training has been provided to 177 health workers and community volunteers.
I've been trained in the maternal, child, infant, young feeding, that is nutrition. And we work with the peer educators, adolescents, that's youth-friendly corner, under this clinic, Chilanga Health Center.
Youth-friendly corner is just a corner where we meet as adolescents or as young people or as youths. We discuss challenges that we usually face in the community and also problems that we have. So we come together to come up with one idea.
It's not good to deliver from homes because maybe one can have some complications while giving birth, and only the health personnel can be able to help.
The value of the MDGI supplies provided to the clinic totaled $90,000 US 171, which is equivalent to 856,000 kwacha 624, while the cost of the refurbishment was $37,000 728, which is equivalent to 358,000 kwacha 416.
We are so grateful because this will help us reduce the maternal and neonatal mortality.
Since November 2014, the health center has received support from the MDGI program in integrated outreach, training of health workers and community, infrastructure works, equipment, and supplies. The European Union Ambassador to Zambia and COMESA, His Excellency Alessandro Mariani, echoed the success of the MDGI program to community participation, and the UNICEF Zambia representative Hamid El-Bashar Ibrahim shared his excitement on the successful implementation of the MDGI program.
Definitely since my arrival, I did understand the importance of this program, of the MDGI program, which is a great partnership amongst the Ministry of Health, And I wish to really congratulate the Permanent Secretary and through you, all the people working at the ministry, both in Lusaka and in the provinces.
It came in 2013 and the program was conceived in 2013 and it started the implementation in 2014. It should be for 4 years and it is fully funded by the European Union in a total amount of $63 million. And the very major objective is to reduce maternal mortality and under 5 mortality.
For us as Ministry of Health, this is what our mission statement talks about. It summarizes what has happened here. Equity of access to quality health services as close to the family as possible.
We want to assure you to say all these facilities that you've put across here, we shall make use of them, and all the workers, the community workers that are there, we shall make sure that all the women in the community come and have quality and good health delivery at the clinic here.